I've gotten this question a few times. I figured I'd make a video to answer this. ACL tears are kind of common in dogs. The larger breed dogs tend to be more susceptible to these ACL tears. There are certain factors that come into play. If they're overweight, it can be a big risk for this type of injury. If they're inconsistent with their activity, there's something called weekend warrior syndrome, which is when they're inactive all week and then on the weekend they go and do some really high activity things, and it can make them more susceptible to this injury. Ollie's surgeon had mentioned that sudden stops and turns and also going in a forward downward motion, such as down off the steps, down off a couch, jumping off a bed, those things can actually cause this injury as well. It is very common if a dog tears one ACL that they will tear the other ACL within the year. And most often it happens before you even get to surgery. With Ollie, we don't even know what happened. We put him outside in our fenced-in area. When we came home from dinner to let him back in, he suddenly couldn't walk. So his 8 to 12 week recovery ended up being more about 24 weeks. After that, there was rehab. We did laser therapy and hydrotherapy. There's ways to try to prevent this injury, such as keeping their weight down, making sure they get consistent exercise, and even taking joint supplements. I'm not a vet. This is just information that I've learned along the way, and I hope you never have to face this situation.